Nurses should not be allowed to wear white coats in the hospital. In recent years, in the US, a large proportion of nurses have been trying to blur the lines and confuse patients as to what their actual role is in healthcare settings. Nurses are not doctors. On average, doctors receive 21,000 hours of training before they are allowed to practice medicine, whereas someone with a doctorate in nursing is required to complete 1,000 training hours to graduate. American nurses have been lobbying to gain the right to treat patients autonomously without the supervision of physicians, despite being underqualified and inadequately trained for independent practice. There are nurses who received online nursing doctoral degrees who call themselves doctor in healthcare settings even though they are not physicians. As stated in the title, many nurses have also started wearing white coats in the hospital to give the impression of being doctors. If you want to be a doctor, go to medical school. Put in the time, take on the debt, and do things the right way instead of trying to deceive patients into thinking you are something you are not. Is this an American thing? I am a physician in Canada and literally no nurses wear white coats. Most of us doctors don't even wear white coats either. We just wear scrubs. Nurses in my country don't have the choice but to wear the hospital/medical institution's dress code specialized for nurses and have a clear note that says nurse on it. They are also not wearing stethoscopes as it's only doctors that have them, that way you can always differentiate. Imagine if prosecutors and defense attorneys wore judicial robes to court in front of a judge. Everybody would freak out. At least they're all JDS. But when non-physicians wear white coats it's okay. Like yeah, I get the argument about sterile clothing. But pick another style of uniform. Let's not forget about the chiropractors wearing their white coat. Yikes. Nice to see this post attracted a lot of attention in a non-medical subreddit. I agree 100% despite the salty nurses in the comments. You gotta earn that white coat. Otherwise you are in scrubs. This is the way. I'm a nurse and I completely agree with this. There is even sometimes a respiratory therapist that wears one at my hospital and I'm just like WTF are you doing LOL. Exactly, it's as if an army recruit wears the exact same outfit as an army general. They're all in the military in the end, so does it really matter? Of course. They call it a white coat ceremony for a reason. I so agree with this. If you want a white coat, go to medical vet or dental school. What's even worse is not just wearing white, but acting like doctors. They enter the room and portray themselves as if they are a doctor and half the time you don't know who you're getting. You'd be shocked at the amount of people who wear white coats in my hospital actually. Social workers, respiratory therapists, and sometimes PT and OT wear them. If you want a white coat, go to medical school. It's really quite simple. I love this post. And yes, I am a physician. I agree YAAI more with the body of the post than the title. I couldn't care less about white coat, which to some, is so closely tied to the pomp and ceremony of being a doctor. The main concern here is healthcare and human lives. Unqualified practitioners, yes that's NPS, DNPs, PA, and whatever letter salad they have after their names, are gaining independent practice rights with little to no experience. They go through 1/20th and even 1/30th of the training MDs and DOs do, and it's simply not at all the same. They are well intentioned, I believe that for the most part. But I think they also don't know what they don't know. It's a huge blind spot in their training. I don't give a shit about the coats. I don't even give a shit about the money anymore, as long as I can pay back my loans. I do care about the patient care. I can't recall the last time a physician actually saw me when I entered a hospital for emergency care, only PA and nurses. Only time I've seen a doctor over the last decade has been for physicals. Asterisk now that would be like me, Dave Chappelle, the comedian, walking down the street in a cop uniform. Somebody might run up on me saying, "Oh, thank God. Officer, help us. Come on. They're over here. Help us. OHOH. Just because I'm dressed this way does not make me a police officer. Star. Nurse here. My school had a white coat ceremony, it was weird. I do not think any person other than those holding an MD or DO should be called doctor in a clinical setting. In nursing school, we had a lot of PhDs and DNPs to whom we referred to as doctor, like in all academia. When we were in clinical, they wore a white coat and would clarify they were a doctor of nursing in front of patients, while both of us were in the room. In an ideal world, all NPS would have years and years of experience. But, the diploma mill has definitely cheapened the profession. Physician here. NPS can have the white coat as far as I'm concerned. I haven't worn mine since first month of internship. Most docs I work with don't wear one either. But no way should people who hold a doctorate in nursing be introducing themselves as doctor while in a clinical setting. It's deliberate misrepresentation. You don't hear PharmDs introducing themselves as Dr. so-and-so on the wards. Kinda sucks that you have to take the debt to get a profession that literally saves lives. As a nurse I agree. There is also an unexpected surplus of nurses with NP and DNP certs now because they've been offered online that the job market is flooded. This is causing main boards and organizations to reconsider how educational programs should be set up. This is of less concern than being treated by someone who learned online how to prescribe medicine. There has been a big trend the last few decades of non-physicians trying to encroach more and more into the duties of physicians. I am a pharmacist and there are pharmacist interest groups who are lobbying hard for things ranging from small prescriptive authority to allow minor changes in dosages when mistakes are caught all the way up to full-on prescriptive authority to write prescriptions for whatever they want. It's madness. Something similar is happening in the dental community. Dental hygienists and assistants want to be able to do basically fillings. As a dental student I do not agree with this. Dental hygienists and assistants have a 2-year degree, if that. Some assistants don't even get a certificate and just know a dentist in a private practice who will let them train and work. A lot of my friends in undergrad did this to get more shadowing hours. Why is it that I'm going $500,000 in debt to drill in someone's mouth if someone who only went to a community college can do that? You can say, well, a dentist gets paid more. Believe me, I won't start making the big bucks until my loans are at least knocked in half. We're talking 5+ years out of school with living extremely minimally. Also, if a hygienist can do some of what a dentist can do and charge less, that will save the patient's money, and in result the dentist may lose clients. Some people don't care about the knowledge of the person working on them when it comes to their teeth because dentistry still isn't seen as essential to many people. This really annoys me and I completely support those dentists lobbying against this. I totally see where you're coming from.